Utilization management is one of the many non-traditional bedside jobs a nurse can pursue. It also has a high potential for a work-from-home position. In today's episode, we will look at what utilization management is, who this position is a good fit for, and how to move into this position.
Welcome to the Stay at Home Nurse Podcast. I'm your host, Deanna Cooper Gillingham. For over 25 years, I've strived to use my nurse credentials to find work that fit my lifestyle. Whether it was raising my 4 children and 3 fur babies, traveling the world, or moving to Mexico and living on the Caribbean Sea. Sometimes I succeeded, and sometimes I failed, but I always learned from the experience. Now, I want to help you by sharing what worked and what didn't work. There are so many opportunities out there for nurses today. The Stay at Home Nurse Podcast will inspire and equip you to have a nursing career that is meaningful and supports your lifestyle. Now let's get started.
Welcome to this week's episode of the Stay at Home Nurse Podcast. I am so excited to talk to you today about utilization management. This is a great way for a nurse to move beyond the bedside and a great way for a nurse to potentially work from home. So, what is utilization management? Well, the definition of utilization management and utilization review, according to URAC, which was formerly the Utilization Review Accreditation Commission, is that utilization management is the evaluation of the medical necessity, appropriateness, and efficiency of the use of healthcare services, procedures, and facilities under the provisions of the applicable health benefits plan. Utilization management describes proactive actions such as discharge planning, concurrent review, and pre-certification. Utilization review is similar to utilization management, but where utilization management is proactive, utilization review is retrospective, as it is the review of cases after healthcare services have been carried out. Okay, that's kind of dry and boring because it's a definition. So let's take a look at this and see what really is utilization management and utilization review. We're going to do this by picking apart the definition. Utilization management is the evaluation of the medical necessity, appropriateness, and efficiency of the use of healthcare services. This means that we make sure that any procedure that is paid for by the insurance contract is necessary. Now you may be thinking, everything is necessary, isn't it? Why else would you have it done? But there are cosmetic procedures. There are procedures that maybe don't really have a benefit but are new or experimental. There may be an off-label use of a procedure. Now, this is not to say that they would not be covered. It's just to say that they would require more stringent review to decide if they should be covered. This not only protects the health plan from paying for unnecessary procedures, but it also protects the patient so that they don't undergo an unnecessary procedure that may have side effects or very little benefit. Next, let's look at that next sentence that says utilization management describes proactive actions such as discharge planning, concurrent review, and pre-certification. Those words are a mouthful, and they're words that are very commonly used in utilization management and case management, but not necessarily in our regular bedside nursing jobs. So discharge planning is just where is this patient going to go once they leave the hospital. Most people go home to where they were before they came into the hospital, but not everybody can. Some people may need to go to rehabilitation or a skilled nursing facility, or they may need things like home health to be able to return home. They may need durable medical equipment. So this is discharge planning. Concurrent review means that they have been approved to be admitted to the hospital, but should they be staying there? Let's say a patient has been in the hospital for 3 days. Do they need a 4th day? Is that covered? Are they still getting benefit from being in the hospital? And then pre-certification actually comes before concurrent review, but pre-certification is, should they even be admitted to the hospital in the first place? Let's say somebody needs a total knee replacement. They would look at the criteria, see if the criteria is met, and then pre-certify or pre-authorize that procedure or admission. Okay, as we stated previously, utilization review is very similar to utilization management. It's just done retrospectively or after the actual procedure, admission, or service has already occurred. Both utilization review and utilization management ensure that services provided are medically necessary and provided at the appropriate and least costly level of care. Many people think that this is only a concern for the payer source, but in reality, it's the job of all nurses. As patient advocates, nurses understand that undergoing an unnecessary service, test, treatment, or admission is not in the best interest of the patient. Nurses also understand that most patients will have some degree of cost sharing, whether in the form of a copay, a coinsurance, a deductible, or a benefit maximum. Ensuring that the costs are contained ultimately benefits the patient as well as the payer source. Now, as we touched on earlier, there are three main types of utilization management: prospective, concurrent, and retrospective, which is technically utilization review. Prospective review, or pre-certification, is done prior to the elective admission or procedure to ensure the requested service is necessary, meets criteria for coverage, and is at the appropriate level of care. So let's look at level of care for a minute. Level of care means, is this an outpatient procedure? Should it be done at an ambulatory surgery center? Is it an inpatient procedure? If it's an admission, is it a regular admission or is it an ICU level of care? Okay, you get the idea. Now let's move on to the concurrent review. The concurrent review includes continued stay review and is conducted as the care is occurring. This includes reviews for admissions that were not already pre-certified, as well as to extend care that was pre-certified. During the concurrent review, you're also looking at, are they at the correct level of care? Do they still need to be in the ICU? Should they be on the step-down unit? Should they be on a regular floor? Should they be discharged? Should they maybe go to a rehab facility? Should they go home with home health? Should they go to a SNF? These are all things that would be looked at during a concurrent review. Another thing looked at during a concurrent review is that the patient is progressing. The goal of every admission is to discharge the patient. So we want to see that they're progressing towards discharge. If they're not ready to discharge home, then we need to get them ready for rehab or SNF or some other form of care. We also want to see that things are being done in a timely manner so that a patient is not staying in the hospital for 2 weeks for something that they should have only been in the hospital for 10 days for. Again, a lot of people think this is not a concern for the patient, but we all know the longer the patient is in the hospital, the more that they deteriorate and the more that they have a chance of coming across some other type of infection or complication. Okay, let's take just a second to look at retrospective review. This is done after care has already occurred. So why would we care about reviewing it after it has already happened? One reason would be for an audit, to go back and look at cases that have already occurred to make sure that they should have actually occurred. Maybe this was an emergency admission. Should they have been admitted or should it have been an outpatient? Should they have been sent home? Should they have been sent to a lower level of care? Okay, now let's get to the good stuff. How much do utilization review or utilization management nurses make? According to Salary.com, the median salary for an RN utilization review nurse is about $81,700, with a range from $64,000 to $98,000. Now again, the salary varies based on geographical location, years of experience, and several other factors. Next, let's look at what utilization review nurses actually do. During their workday, they will receive requests for approval. This may be via phone, email, fax, or a computer or online software. They will review the client's health insurance contract. Are they covered? Is the requested service or procedure covered? Is there anyone else that may be financially responsible, such as workers' compensation or auto insurance? They review the medical records and they determine if the criteria is met for the request to be approved. This usually involves using some type of evidence-based guidelines. There are software programs that assist with this, such as Interqual and MCG. Think of Interqual and MCG as a big brain filled with information on the criteria that needs to be met for a certain procedure, inpatient stay, hospital admission, anything like that. This is where you find all of that evidence-based information. If the utilization management nurse determines that the procedure or the request should be approved, she will then document. Remember, if it's not documented, it's not done. And then she will send the authorization to the requesting provider, letting them know that the request has been approved and providing them with an authorization number. If the utilization management nurse cannot approve the procedure, she needs to send it to the medical director to review. She'll need to write up a summary and present this to the medical director. The medical director will ultimately be the one who will either approve or deny the procedure. Nurses cannot deny based on medical necessity. This needs to come from the medical director. But the utilization review or utilization management nurse will write up the case and present it to the medical director. Now, the utilization review or utilization management nurse can deny based on other factors, such as if the person was not covered under the health care benefit plan at the time of the procedure, if the requested procedure is a contract exclusion, things like that. Depending on where she works, she may be able to deny based on contract, but not based on medical necessity. Now, this day in the life scenario was based on a utilization review nurse that is working for a payer source, but utilization review nurses can also work for the provider side, such as a doctor's office, a hospital, or an outpatient facility. In this case, they would be the one gathering all the patient information to make sure that when the utilization review/management nurse on the payer side got the information, they could easily provide an authorization. Next, I want to look at who utilization review/utilization management nurses work with. They have very little patient interaction, sometimes no patient interaction. They work a lot with computers, and if they're on the phone queue, they will speak with the utilization review nurse at the requesting facility or other office staff. They work with the medical director at the place of employment. This makes utilization management/review a great option for the nurse who is truly burned out with patient care and burned out with dealing with patients in general. But it makes it a very bad choice for a nurse who still wants to have an impact on her clients directly. For this, I would recommend case management. You'll want to refer back to last week's episode, episode 35, for more information on case management, and we will have a link in the show notes. So what skills are required for utilization review or management? Of course, they need strong computer skills. You have got to not be afraid of a computer. You're going to have multiple tabs open. You have to be able to copy and paste. You have to be able to be looking at one piece of information and typing it into another piece of software. You need to be able to move quickly and efficiently through different pieces of software and different tabs. You need to be able to do research and find the information that you need to approve or deny a procedure quickly. You need to work quickly and efficiently. You will be on a phone queue or you'll be receiving faxes all the time, and you need to be able to keep up with all of the workload that is coming in, and you need to be able to type. It will be much easier for you to type up the documentation if you can actually type. In fact, some employers will require you to take a typing test before you are hired. Okay, so who are utilization review and utilization management nurses employed by? Work from home employers include insurance companies and workers' compensation companies, among others. Hospitals, physicians' offices, rehabilitation centers, skilled nursing facilities, home health agencies, and durable medical equipment companies also hire, but from the other end, they're the ones requesting and gathering the information to support the request. They usually work at a facility in-house, at an office, or in the hospital. But as more medical records are online, more and more are having home positions. And especially with COVID, many companies are now allowing their utilization review and utilization management nurses to work from home at times. Next, we're going to look at how to get a utilization management position. Utilization management builds on the skill set of the clinical nurse. A firm clinical background is a must, and most employers want 1 to 2 years of recent acute hospital experience when hiring for utilization review or utilization management. In addition to the clinical background, utilization management and utilization review nurses must understand insurance principles, levels of care, and care setting. And finally, nurses transitioning into this field must learn and understand the utilization management process. Yes, just like the nursing process, there's a utilization management process. In addition, there are tools used by utilization managers such as MCG and Interqual, which mentioned previously. These use evidence-based criteria to determine if medical necessity is met. Most employers use these types of software and hire those who have experience using one of these platforms. The problem is, you can't get training and experience with MCG unless you work for an employer who uses MCG and you use it in your job. So it's a catch-22 of needing MCG training to get a job, but being unable to get the job unless you have MCG training. If you've been listening to this podcast for a while now, you know that I love to find solutions for problems. So I and the Case Management Institute reached out to MCG. We have partnered with MCG to bring you the first and only utilization management and MCG training course outside of an employer. That's right. If you want to move into a utilization management or utilization review job and you don't have MCG experience, this is the course for you. In addition to the valuable MCG training, this course includes instruction on insurance principles, levels of care, care settings, and the utilization management process. And to make it even sweeter, after completing the Case Management Institute course, students are eligible to sit for MCG certification. This really helps you to stand out among the hundreds of applicants for a coveted utilization management or utilization review position. In this course, we don't just train you, we actually let you walk through cases. We have case studies set up that you would actually walk through, use the software, and write up the approval just like you would working in utilization management. This gives you as close to hands-on experience as you can possibly get. You'll be toggling through multiple tabs, looking for information, reviewing that information against the guidelines, and then writing up your approval just like you would in an actual job. In addition to the training you receive, you will also get a total of 9 CNEs for completing the program. 4 of these CNEs come from Wild Iris Medical Education Incorporated, an accredited provider by the American Nurse Credentialing Center's Commission on Accreditation, plus an additional 5 CNEs come through MCG. That's the total of 9 CNEs. As we talked about last week, utilization management can be one of the roles performed by a case manager. That is why during Case Management Week, which is actually ending this week, ending tomorrow, we are offering a special. If you act really quickly, you can get 15% off all of our courses and an additional 10% off when you use the coupon code TSAHN10. That stands for the Stay at Home Nurse 10, TSAHN 10, all lowercase, all together, no spaces, during Case Management Week. Now, if you're listening to this after Case Management Week and you want to take this course, don't worry, we have you covered. As a listener of the Stay at Home Nurse podcast, we will give you 20% off any one of our courses using the coupon code TSAHN20. Again, all lowercase, no spaces, TSAHN20. As a podcast listener, you can get 20% off. This is not combinable with any sales or discounts. As I mentioned previously, utilization management can be one of the roles that a case manager does. We actually offer 3 different courses. One is the Foundations of Case Management, which we talked about last week, and the Utilization Management, which we talked about today. But we also offer a combined course. This is the ultimate course for somebody who wants to work as a case manager and wants the ability to do utilization management also. This combined course makes you extremely marketable because now you have 2 skill sets, case management and utilization management, which are both popular work-from-home jobs for nurses. So who is utilization management and utilization review a good fit for? Nurses with recent acute care experience, nurses that are comfortable with computers, nurses who can work with multiple browsers and tabs and applications all open at the same time, and nurses with good typing skills. Who is utilization management and utilization review not a good fit for? If you still really desire patient interaction, you probably don't want to work in this position. You're going to be disappointed with the lack of patient interaction. But as we said last week, if you desire a work-from-home job that still has patient interaction, case management may be for you. I again invite you to listen to last week's episode, episode 35, which we will link to in the show notes. Okay, if you would like more information on our course, please go to casemanagementinstitute.com. Again, that's casemanagementinstitute.com. From that homepage, you will see links to our courses. You can also click the big button at the top of the page that says, I want to learn more about case management. This will take you to our case management and utilization management section. And don't worry, we will have a link to this in the show notes. If you can't find the show notes in your favorite podcast player, then go to thestayathome.nurse.com, click on the podcast tab, and look for episode 36. That's where you'll find all the information we linked to from this week's episode. Now, if you're listening to this after October 16th of 2020 and you've missed out on the sale, don't worry. You can still use the 20% off by typing in TSAHN20 during checkout. Also, while you're on the website, you may want to sign up for our emails. That is on the homepage of thecasemagementinstitute.com. And if you scroll to the bottom, you will find a place where you can enter your email address and your name, and we will sign you up so that you can get our newsletters and get notified when we have our sales. Okay, that's a wrap for this week's episode. I hope you are finding this series on work from home nursing jobs incredibly helpful. If you have a friend, colleague, or coworker who you feel would benefit from listening to this podcast, I hope you'll share it with them. I look forward to speaking with you again next week on the Stay at Home Nurse podcast. Make sure you hit subscribe so you never miss an episode. Adios from beautiful Puerto Aventuras, Mexico.